Jessica Dixon, and I'm a nursing student here at South Alabama, and today I will be performing the wet to dry dressing change. So the first thing that I would do is I would verify the order and the hospital policy. Okay, and after I have done that, I would gather my equipment. My equipment is gathered here today, so I would now perform hand hygiene. So now I would verify the patient using two identifiers. For this procedure, we will be using the medical record number and the name of the patient. So the name of the patient is Jaguar J. Jones, and then the medical record number is 4176352, and we have 4176352. So now I would look for any allergies. This patient is allergic to penicillin, and that is on the order form as well. So now I would explain the procedure to the patient, and I would also provide the patient with privacy. So now I'm going to position the trash can, and I'm going to perform hand hygiene. And then I would raise the bed to a working height. I would lower the side rail, and I would position the patient comfortably. And now I will apply my gloves, my clean gloves, and my goggles. Okay, and now I'm going to expose the suture line and the dressing, and now I'm going to remove the dressing, and I will pull towards the wound. And now I'm going to pull it and move it away from the patient, face it away from the patient. So now I would assess the drainage. I will be looking for the type, the amount, the color, consistency, and whether or not there is an odor. And then now I'm going to get the secondary gauze. And now I'm going to look at the wound. I'm going to look at the size, whether it has granulation tissue, necrotic, or slough. And now I'm going to palpate the peri wound. I will be noting for any redness, edema, or tenderness. Now I'm going to discard the dressing. I will put my gloves towards the trash can. I'll place them towards the trash can while I'm taking them off and down away from me. And now I will open my kit, and I will get the sterile fold out. At this point, anything that is hanging off would be considered contaminated. So I'm going to empty my kit onto the sterile field, keeping in mind of the 1-inch border. And now I'm going to check the expiration date on the saline bottle. And once I see that it's not expired, I'm going to palm the label, and I'm going to open it and have the top facing upward. I'm going to pour the saline without splashing and without contaminating the container. Then I'm going to set this aside without turning away from my sterile field, because that would be considered contaminated. I would also like to note that my sterile field should be at waist level, otherwise it would be considered contaminated. So now I'm going to apply my sterile gloves. I'm going to grab with the non-dominant hand. Now I'm going to do like this, making sure that I keep my thumb well away. Okay. Now I will arrange my supplies, keeping in mind of the 1-inch border. Okay, and now I will place the needed gauze in the container with without contaminating the top. Okay, so now that that is done, I will look at my intact suture line. I will note the size, the approximation of the edges, and whether or not there is drainage. So now I'm going to clean the suture line. I'm going to come in here without contaminating the container. I'm going to squeeze out all the water. And I'm going to put in my hand to make sure that it would not touch the patient's skin. And I clean from the least contaminated to most contaminated, and the middle of the suture line is the least contaminated, so I'll do that in one swipe and discard without letting my hands drop below my waist. Now I'm going to do the other side of the wound in one single swipe and discard without dropping below. And now I'll do the same thing on the last side and discard. So now I will take a sterile gauze and I will pat dry the wound and discard. And now it is time to fill the open wound. I'm going to get a gauze. I'm going to wring it out. This time I'm going to fluff the gauze. And then once I'm done fluffing, I will set it inside of the wound, making sure not to touch anything else. And I would do this until the wound was full. Okay, now I'm going to place a sterile gauze on top, and now the ABD pad. Okay, now that that is done, I will remove my sterile gloves. I will do this glove to glove, this in the other hand, and skin to skin, pointing down towards the trash can, and discard. So now I will tape the ABD pad to the patient. Okay, now that is done, I will also take off another piece of tape and I will stick it on top of the ABD pad, and I would write the time, the date, and my initials. And then I would I would position the patient comfortably. I would make sure to pull down all of their gowns and make sure that I maintain privacy. I would make sure that they were comfortable, and I would lower the bed and I would raise the side rail. Then I will gather all of my equipment, and then I will perform hand hygiene, and then I would document my findings of the open wound and the intact suture line. I would note whether or not it was granulation tissue, necrotic, or slough, and whether or not there was an odor. I would also note if there was any edema, redness, or tenderness, and the type of drainage, the amount, color, consistency, and whether or not there was an odor. For the intact suture line, I would document the approximation of the edges, the size, and whether or not there is drainage. And I would also document how the patient handled the procedure. And this concludes my what to dry dressing change checkoff.